This is a presentation on acupuncture and myofascial lines for the hip, pelvis, and low back. Let's get right into the material. And the first point on this intro reads, the anatomy of four for treating the hip. So when treating hip pain and hip or pelvic disorders in general, one of the first things that we want to do is determine where the primary symptoms are located and in what region. Does the client have pain more in the posterior region? So here we see the superficial back line, and it looks a lot like the urinary bladder meridian. And it's very common to see clients who have lumbar conditions or perhaps pain in the sacroiliac area, and then the pain is also moving over into the area of GB30 and into the lateral line. It's also very common to see sciatica that begins in the posterior region or down the urinary bladder meridian, and then as it gets worse, it may move over into the lateral line. So this relationship then between the posterior and lateral regions, or between the urinary bladder and gallbladder meridian, is very common to see. Now, also involved in the hips are the anterior regions, so we can talk about functional muscle groups in the anterior area. We can talk about the stomach meridian, which we see looks a lot like this superficial front line. And in understanding how the meridians relate to the muscles and to the functional anatomy of the hip, then we can get a better handle on how to treat it using traditional approaches or using the balance method or using Master Dong's points. I want to bring your attention to this muscle here, rectus femoris, which is a hip flexor. And it's very common in today's world that people spend a lot of time sitting, they're working in offices, they're sitting at their desk, and this can cause tightness and contraction in the hip flexors and then lead to hip and pelvic disorders. So in understanding the muscle groups like the hip flexors and the hip extensors, or the abductors and the adductors, it really gives us a much better handle on how to proceed with treating hip conditions. Here we see the lateral line, and it looks a lot like the gallbladder meridian. It includes the glutes as well as the IT band. And then this image shows the deep front line, which is connected to all three of the leg yin meridians, as well as the adductors in this area of the medial thigh, as well as the deep fascia of the pelvis. Let's jump right into looking at some of the most common points that are used for hip pain, both in TCM and in the Master Dong system. So in TCM, common points include LI4, Sanjiao 5, and gallbladder 41. Gallbladder meridian points include GB29, GB30, 31, 34, and 41. And then you'll also find some sources use urinary bladder points and stomach points as well. Now, these aren't my favorite points to use on the stomach meridian when treating hip conditions. There's another group that I prefer to use that relates to the hip flexors. And so in understanding how the meridians and the points relate to the muscle groups and the functional anatomy, that's going to help you to get better results. So you can get results with TCM. I did that for a lot of years, and I used point prescriptions just like this for my clients, and you'll get some clients that respond real well to it, but there'll also be a lot of clients that get minimal results, and it's not uncommon that you might do these points and the client gets 30% better or 40% better, but then they plateau out and they hit a tolerance. And if you don't understand the anatomy of the hip and these muscle groups and these myofascial lines, then you're probably not going to know how to proceed and how to change your point prescriptions. And the same thing can happen with the Dong's points. I started using Dong's points for the hip, and it was essentially the same type of thing that I was getting with the TCM. When I was using Master Dong's points for treating the neck and the low back, I got more exceptional results than with the TCM methods. And they both can be good, and I still use both of them even today. However, what impressed me about the Tung points were that the results were so fast and so effective, and I didn't have to needle into their back. I didn't have to needle into their hip. I could do points in their arms or in their hands and get really fast and effective results. And so that created a really strong impression on me. But then when I started using the Tung points for the hips, it was fairly equivalent to what I was seeing with TCM. And in many cases, I found that TCM and needling local points like GB30 would give a better result when I first started practicing this. So I worked through this for a lot of years, and I started studying the anatomy of it. And because I'm a yoga teacher too, I was really into understanding the structure and the function and how to use movement as well. And what I've found is that to get the best results using these points, like the Master Dong points or non-local points, you really need to apply movement as well. And this is one thing that I like about the Master Dong system, is that you can use points like the shoulder triplets here. You can do a group of 3 points in the shoulder, either on a vertical line or a horizontal line. You can do a group of 3 points in the deltoid and then have the client do movements. So I've got a group of seated movements and standing movements, as well as movements that they do on the table, that I will have them do when I have those non-local points in. And once you start doing non-local needling and then having the client move the affected area, you're going to get much better results. And then you can give them some exercises to take home with them so that they're doing movements that are therapeutic to their needs. However, to get the best results with that, you really do need to understand things like internal rotation, external rotation within the femur, how that connects to the movement in the pelvis. You also need to understand things like anterior pelvic tilt, how that can relate to low back pain, as well as lateral tilts in the pelvis and posterior tilts as well. So this is something that I go into in great detail in my course, and we're going to continue to discuss some more of it here. So I've written here in red, it reads groin pain. TCM will often use liver 3 and local points on the liver and spleen meridian for treating groin pain. And then in the Dong system, they'll use Lingu, which is very close to Li4, and then 33.12 is also indicated for groin pain. Groin pain was something that I struggled with for a number of years too, because in the TCM approach, we typically use points like liver 3 and these local points, but the local points in the area of the upper thigh, they're not too convenient to needle, and I only really like to use those towards the end of a series of treatments once I've established trust and rapport, because those points on the medial thigh can be quite sensitive and people do tend to hold a lot of emotions there, and it's more invasive. You have to have people disrobe. They're not that easy to get to, so you don't need to be needling those points. And when you learn about the functional anatomy of the hip, you can see how there's other points that we can needle to get results. This next point reads TCM styles, and they'll primarily utilize gallbladder and urinary bladder meridian points for treating conditions of the hip. Also, in TCM styles, we'll refer to hip pain and disorders as B syndrome, and we can recognize liver and kidney patterns as a part of that. So, Zong Fu methods of pattern identification are really important when we are using herbs and in the practice of internal medicine. However, when treating the hip joint, it becomes increasingly important to use a meridian systems approach, as well as understanding the functional anatomy of the hip. So if you're only applying TCM methods of pattern identification, identifying hip pain as B syndrome, and then doing the common TCM points, it's really more of a shotgun style approach, and there's going to be things that you're missing. Some of the points you'll certainly get results from, but with your clients, you're going to see some clients that get good results and some that don't get any results. However, by understanding the different muscle groups and these fascial lines and how this fits into our TCM methods, as well as Master Dong's points, then you're going to be much better prepared at developing point prescriptions and understanding what groups of points you should use in some cases versus points you should use in other cases. And I think this is a fundamental problem and challenge within TCM, is that many things can get overlooked, and we see that in the example of the hips. So because it's such a complex structure, we've got a lot of muscles there, and we've got antagonistic muscle groups as well. So when we speak of antagonistic muscle groups, then it's really important to understand that when one muscle or group of muscles contracts, other muscles are going to lengthen. And where people feel pain is not always in the areas of chronic contraction. They often feel pain where there has been chronic strain or over lengthening of the muscles. So this is something that I discuss in more detail, and you'll see some more information in that in the beginning slides. But this is a really important thing to consider for the hips, because when we speak about the functional anatomy and the hip flexors and the hip extensors, as well as the other muscle groups, we start to see that a lot of these dynamics about tension in the system start to play out within the hips. So for instance, if a client spends a lot of time in a seated position, perhaps they have an office job or they're sitting for long periods of time as they work, that's going to cause chronic contraction through the hip flexors, and that can overstrain the antagonistic muscle groups, specifically in the back and through the glutes or the hip extensors. So understanding these dynamics and antagonistic relationships that are a part of the functional activity of the hip is really what's required to get to the next level and get the results that you're capable of. However, if you're only doing a TCM style approach and identifying it as B syndrome and as a liver or kidney pattern, you're going to have a more narrow view of how to approach it and how to treat it. And certainly some of the points will be beneficial, but you won't be able to target the points more precisely. The next point here, it reads Dong's points. The shoulder triplets in 33.08 and 33.09 are on the superficial back arm line. So here we see the superficial back arm line. It includes the trapezius and the deltoid. And then the forearm extensors are a part of that, as well as the dorsal myofascial part of the hand. So there are numerous points on this superficial back arm line or on the large intestine and Sanjiao meridians that we can use for treating hip and lumbar conditions. And we find in the traditional point protocols, we find LI4 and Sanjiao 5 often being recommended. However, there are other groups that we can use, and in the Dong system, we use the shoulder triplets. Now, one thing to understand about this superficial back arm line is that it has a strong effect on this back functional line because the lats attach to the humerus in the area of the deltoid. So what appears to be going on then is that mechanical signals are being sent through these myofascial lines, and when we needle points on this superficial back arm line, it's able to have a strong effect on the lats and even into the glutes as well. Now, one thing to understand about the Dong's points, and I used these points for 2 or 3 years before I started to really get an understanding of how they worked and how to get the best results from them. And this is what I want to share with you, is how to get better results. Because if you have a client and you learn about Dong's points in the deltoid for hip pain, and you just have them lay on the table and you put those 3 deltoid points in, and maybe you do Sanjiao 5 and GB41 as well, and you do your point selections and you just put them on the table and you do those points, you'll likely get some benefits. They may get anywhere from 20 to 30 or 40% improvement from a single treatment. However, what will likely happen is that in follow-up sessions, if you do the same treatment in the second or third session, they may get some continued improvement, but then somewhere as soon as the second treatment or the third treatment, and very often by the fourth treatment, they're going to reach a tolerance, and then the results will plateau out. And you may have only gotten them about 40 or 50% improvement by that time, or you may find that they get improvement, but then the pain comes back a day or 2 or 3 days later. So this is a very common thing when treating the hips. And this will very frequently happen if you just do these points and you just have them lay down on the table. So in understanding the functional anatomy of the hip and understanding internal rotation and external rotation and what muscles are involved, then it's going to give you a better handle not only on your point prescriptions, but on using movement as part of the therapy. And if you really want to get the best results, you've got to understand how these people are moving, how there are structural issues of the hip involved in these conditions, and how you can correct it using acupuncture and very simple movements. I'm just going to read what else I wrote here at the bottom. It says, these only get to a superficial level. So we can see from the diagrams here that this back functional line, it includes the lats, but these are at a superficial level. And underneath the lats and the glutes, we have other functional muscle groups. So you really need to understand what points you can use that are going to have beneficial effects on the external rotators or on the internal rotators or on the extensors. And this is what we want to cover through the length of this presentation and course. The next part reads here that the Dong points, they can be as effective as needling distal points on the gallbladder meridian. So you can needle a point like GB31 that's located here in the IT band, and you can use that for treating hip pain and get some results. Now, it may not resolve completely. The client may just get a little bit of improvement, or the pain may come back, because the lateral line, much like this back functional line, exists at a more superficial level, and then there's deeper muscle groups involved. So what I've found in doing these points then is that you can get similar results with the shoulder triplets as you get with a point like GB31 or even GB30, but you may not be reaching those deeper levels. Okay, so really important thing to understand. And a lot of the problems that you're having in treating the hips right now are probably resulting from not having a good handle on the functional anatomy, not understanding external rotation and internal rotation, not understanding hip extension and hip flexion and abduction and adduction. So when you start to understand these 6 movements of the hips and how they relate to various points, both local points and distal points, then you're going to start to get results. However, if you're just identifying this as B syndrome and then throwing in the common points and doing some liver points or some kidney points, you're just not going to get as effective results as you can if you understand the anatomy and the muscle groups of the hip.